Hello, my name is Aaliyah Foster Ward, and thank you for taking the time out of your day to listen to me speak on an important issue that is currently affecting our community of Winston, Salem, North Carolina. That issue is infant mortality. Although infant mortality impacts families throughout Forsyth County, the burden falls disproportionately on Black women and their infants. When we say infant mortality, that refers to the death of a child before his or her first birthday. And according to the 2023 State of the County Health Report, Black infants in Forsyth County continue to experience significantly higher rates of infant mortality compared to white infants in the county. This disparity represents one of the county's most pressing health equity concerns. This issue affects more than mothers and infants. The loss of a child has devastating emotional, psychological, and financial consequences for families. High infant mortality rates also reflect broader issues which could be related to healthcare access, poverty, housing, transportation, food security, and systemic inequities. Therefore, infant mortality should not be viewed solely as a medical issue, but also as a community issue that requires collaboration among healthcare organizations, public health agencies, policymakers, as well as community members. The disparities observed in Forsyth County mirror those that are seen nationally. In 2023, infants born to non-Hispanic Black women had the highest infant mortality rate in the United States, at 10.93 deaths per 1,000 live births compared to 4.48 deaths per 1,000 live births among non-Hispanic white women. Disorders related to short gestation and low birth weight were identified as the leading causes of death among infants born to Black women. There are several factors that could contribute to these disparities. Research demonstrates that differences in infant mortality cannot be explained by income or education alone. Social determinants of health, including access to prenatal care, housing stability, transportation, food insecurity, chronic stress, and experience with racism and implicit bias within healthcare systems, all contribute to poorer maternal or infant outcomes. These factors also increase the risk of preterm birth and low birth weight, which are major contributors to infant mortality. Currently, there are multiple organizations in Forsyth County that are working to improve maternal and infant health. The Forsyth County Health Department, healthcare systems such as Novant Health, Atrium Health, Wake Forest Baptist, the WIC program, as well as community organizations provide education regarding prenatal care, breastfeeding, nutrition, safe sleep practices, and postpartum care. These organizations communicate through healthcare providers, social media, educational materials, and community outreach programs. While these efforts have improved awareness, persistent disparities indicate that additional interventions are needed. From a public health perspective, prevention should focus on both healthcare and also social factors. Evidence-based interventions include increasing access to early prenatal care, expanding postpartum services, supporting home visiting programs, and increasing the use of doulas and community health workers. These services help mothers navigate healthcare systems. It provides emotional support and connect families to needed resources. Addressing barriers such as transportation, housing instability, and food insecurity can also help improve birth outcomes and prevent infant deaths. Policy development is another important component of prevention. Local leaders can support policies that increase funding for maternal and child health programs and strengthen partnerships between healthcare systems and community organizations. Policymakers can also support initiatives by promoting culturally competent care and implicit bias training for healthcare professionals. By investing in these programs that address social determinants of health, county leaders can reduce preventable infant deaths and promote health equity. Communication is equally important in reducing these disparities. Traditional methods of communication may not always reach the populations most affected. To effectively communicate with Black women, public health professionals must meet women where they are. Rather than expecting individuals to seek out resources, we should bring the information and services directly into the community. This could involve partnering with churches, beauty salons, schools, neighborhood organizations, and community centers to provide education and resources. Information can be shared through health fairs, community events, social media campaigns, and printed materials such as flyers placed in locations frequently visited by families. Trusted community members, peer mentors, doulas, and community health workers can help deliver information in ways that are culturally appropriate and relatable. Communication strategies should be designed with Black women rather than for Black women. Listening to the experience of women within the community and involving them in developing solutions helps build trust and increases the likelihood that interventions will be successful. As county leaders, you can help strengthen these efforts by investing in outreach initiatives and supporting programs that bring resources directly into neighborhoods with the greatest need. Effective communication, community engagement, and evidence-based policies have the potential to reduce infant mortality and disparities to ensure that every child in Forsyth County has an opportunity for a healthy start in life. Thank you for your time and your commitment to improving the health of our community. Thank you.